Meet Sam. Sam is the CTO of a startup building an application that sends and receives data from electronic health records. His team wants to focus on what they do best: building the best possible user experience, establishing patient and provider workflows, and leveraging their unique skill in big data science. But as they get into it, they realize that hospital customers have complex security and privacy expectations, standards and processes based on HIPAA compliance, and the team's developer tools don't meet these requirements. The cloud hosting environment supports HIPAA, but the hospitals need a lot more. Complex regulations surrounding health and patient data mean that healthcare enterprises have to do deep diligence on every application. Sam and his team may not even get in the door until, well, who knows when? And not being able to quickly meet the hospital's security and integration requirements are the primary reasons why health startups like theirs fail. Thankfully, Sam has the solution. He's discovered MedStack, the platform for app-enabled healthcare. MedStack takes care of auditing, logging, backups, monitoring, encryption, port control, and access control. MedStack utilizes defense in-depth security and offers full-stack compliance in the US and Canada, providing both technology and documentation, saving money they don't have on privacy legal engagements. It offers developer flexibility, so developers don't have to learn new tools. Sam is now a hero. With MedStack, they were able to get to market faster and have more successful implementations, which also meant they were able to help more patients and providers. Healthcare apps are hard. Meet the needs of the industry, accelerate integration, and innovate with MedStack.
All right, welcome back to another episode of MedTech Trends. I'm your host, Dorian. Today we've got with us Balaji Gopalan. So Balaji is joining us from a company called MedStack. To give a little bit of background of where he's coming from. So he's a recognized thought leader, an educator, and a mentor in the field of technology and startup product management and platform strategy. He's known at the Toronto startup ecosystem as the product strategist who brought BlackBerry's iconic BBM, that's BlackBerry Messenger, service to market. Also having worked with many foundational internet companies in building their initial mobile offerings. Balaji is a compassionate advocate of tech for good, platforms, data security and privacy, and digital health. When he's not leading his company at MedStack or acting as a mentor for accelerators, Balaji spends his time as a musician, songwriter. He's also a father and apparently likes to make a lot of breakfast. And I'm assuming that's for your family and not for like strangers just kind of being invited in your house.
Well, depends on the kind of conversation we can have, but sure.
Gotcha. Awesome. Okay, so I really appreciate your time today. Thanks so much for joining us. I have to give you a little bit of kudos too, because this is you're a very well-known person. You've had a lot of success and a lot of history at BlackBerry. So you bring with you a lot of experience and a lot of technical expertise into creating this healthcare company, MedStack. And it's not often we get a guest of your caliber, so to speak. So I definitely appreciate you coming on today.
That's very kind. Thank you very much, Dorian. Happy to be here.
Perfect. So MedStack is we'll get into a little bit of the background, how you got into the space, but I just wanted to kind of set the stage here a little bit. So MedStack is a privacy and a security compliance solution for healthcare apps. Generally speaking, we'll get into a lot more detail. I'm curious with your background though, you've got a lot of experience obviously in technology, telecommunications. You worked on a number of very important projects with notable companies in Canada. Did you pivot into healthcare intentionally? Was there a plan along the way, or how did you get started in this?
Yeah, it's a great question. And once again, I'm very honored to be able to tell my story, MedStack story, in your show. So thank you very much for inviting me. The story of where MedStack came from, like many companies, is an intersection of the background of myself and that of my co-founder, Simon Woodside. I spent a bunch of years developing a very strong fascination with the concept of platform strategy. And by platform, what I mean is, how does one company with a set of technical assets offer those to other companies so that mutually together they can actually deliver value to a customer base? And there's different versions of this in my career. But sort of deep in the recesses of my subconscious, I knew I could do something big with it. One thing I noticed was the platforms are very, very effective at driving industry transformation in what you may call sort of legacy businesses. And Simon was the one who was building things in healthcare. He was running a mobile app development studio. And this is an area that actually has a fair amount of weight in digital health, because a lot of digital health companies are actually founded by healthcare professionals who then go to organizations like his to build the technology that they need. And so that's what he was doing. And he came to me and said, there's a desperate need for a platform that enables this particular item in the development of digital health innovation to work better. And I said, this is the thing I've been waiting for. And that's sort of where the idea for MedStack came from.
Mm-hmm. So I wanted to ask you also, like how you and Simon came together initially. How did you guys meet? And you mentioned, I think in another interview, that so Simon had been working on a number of these healthcare applications, or helping other founders to kind of build out their application. So was this, was it a coincidence you guys met? How did that work out?
It's serendipity, like the best sort of business arrangements often are. What's interesting is that, as you mentioned, I spent a number of years at BlackBerry, which was based in Waterloo, and Simon's company was also based in Waterloo, even though neither one of us actually lived there. But interestingly, we never really directly crossed paths until the timing was right to create MedStack. I was working for a very exciting Toronto startup called Nymi, and Nymi is a wearable technology company in the space of digital identity, which is a space I've been tremendously fascinated by for a long time. And one of the things that we were doing at Nymi was building a developer platform, which was sort of my mission while I was there. And so we had a developer kit that we had put together. We were launching it into the market. And to sort of hype up the launch, we had a little internal developer contest and held a hackathon over a weekend where we ordered some pizza and had some things to drink and whatever, and brought in some very brilliant people from the community to show what the platform could do. And Simon was one of those individuals who'd come to the organization. And what was interesting was that he actually came there under a slightly missed assumption, which was his fascination was digital health. And so we had this wearable technology that was not a healthcare thing, but everybody thought it was, because it was actually using a biological identifier as part of the digital identity strategy. And so he came there thinking he was going to help build a healthcare product, or demonstrate that he had the talent to build a healthcare product. And in that event, we met, and I was thoroughly impressed by him, both his technical acumen, but as well as his product mindset. Even to the tune where we recorded an interview with him for some of that company's marketing materials, and shook our hands and went our separate ways. But I think we made a lasting impression on each other. And when I left that company, he called me up and said, would you like to work together? I have this idea I'd like to run by you. And that's where MedStack came from. And afterwards, we find out we knew all of the same people, but we'd never actually worked together before. But it's been the business and product partnership I've been looking for my entire career.
That's really cool to hear. How long has it been? How long have you known Simon since that day?
Since that day, that was in 2014, I want to say. So now it's almost sort of 7 years since then, and MedStack itself has been a full-time concern for us for coming up on 6 of that. So
Okay. We'll get into for sure all the what MedStack is all about. I'm sure a lot of people are going to be very interested to know what it is that you guys are building out, including some of the recent developments, recent raises, and so on that you guys are looking to do. A little bit more about the background here, because I know you've got a very deep passion for platform strategies, product management, but you're now the CEO of MedStack, CEO and co-founder of MedStack. And how is that different? You've spoken quite a bit about how awesome it is, how much you love the science and the art of actually building products as a product manager. What is it like now being a CEO? And do you need to ever kind of get into the nitty gritty of being a product manager ever?
Well, I never really let it go. And it's kind of how I think and how I would even say Simon thinks that way too. But product management is, in as much as it's, consistent, which it isn't often because it's a relatively new field. But product management is probably the closest thing you can do as a stepping stone towards entrepreneurship, because the core of what product management is balancing the three forces of where a company wants to go strategically in terms of its offer. And if you're a technology startup, but the core of your business is your product that you're building, the needs of your needs and perceptions of your customers, which starts from who are they, and you understand them, to what are they trying to do, how are they doing it today, and why can that be made better in a way that they would appreciate, and what your organization has as assets or talents. And so this is what a product manager spends all the time thinking about, and that's, at least in the early days, is pretty close to what a founder spends their time thinking about, which is why, in very early companies, founders themselves are the product managers of what they're trying to do. And the flip side of that, of course, is the very common vernacular that says product managers are the CEOs of the products. The reason people say that is because of that relationship. And so everything we do at MedStack kind of drives from that mindset. And I wouldn't say we've done everything perfectly, but it certainly drives a lot of our thinking. You reach a point, however, where the work outside of product begins to command more and more of your time, which is, being the public face of the company, telling our message, handling investor relations, board relations, the corporate things, the administrative stuff. I mean, when you're a CEO in the beginning, you are finance and HR and all of these other things that matter, which are equally important, but outside of the realm of what product is. And at that point is when you sort of say, well, we need somebody to steward these day-to-day decisions that we're making to ensure that we're constantly optimizing against those three factors. And that's where the hiring of a product manager comes in. And I would say, given my background, that was a very difficult process, because I had very stringent requirements on what it is that I wanted. And I mean, you can ask my team, I was pretty militant about it. I said, product management is very misunderstood, and this is the thing I want to make sure we do really, really well. And it took us many, many months until finally we hired Marcus Polini, who is an incredible product manager. He lives and breathes this mentality every single day, and is constantly thirsty to up his skill set and his instinct in product management. But a lot of product management is innate instinct, right? And you need to have the soft skills to make it work, which he does to spades. And I couldn't be prouder of him, which allowed me to focus on these other things, which are admittedly pretty new to me. I'm not one of those people who said it was my goal to be a founder from day one. But I took this leap because the mission was just too important to ignore. And I said, this is the thing that I want to try to apply all of my experience to. And I know there's going to be a bunch of learning, which is the work outside of product, that I need to pursue. And, it has been a tremendous learning journey for me.
Well, you've had a lot of presentations, a lot of public lectures, if you will, at startup events and so on. So, and I think one of the things that I found really interesting is that you, having stepped into a CEO role with MedStack, you've become very familiar with the language of healthcare, with what the needs are, but also you're very close to entrepreneurs that are trying to get into the healthcare space. So again, kudos to you for jumping in, because it's a very different ball game, I guess, than coming from the tech world, the telecom world, and that sort of thing. So, and I imagine that was a bit of a stepping stone too, of just getting familiar with how healthcare works and who are the players and how does funding, flow through the system and that sort of thing.
Yeah, I mean, I don't mean to oversimplify it, because it is very complicated, and maybe more complicated than almost any other industry. But the first rule of being successful in the work of innovation, again, draws a direct line back to what I just said about product management. Product management is the management of innovation, but you can't bring changes to an industry space that has some legacy without first understanding how the space works. And that's true of any industry. But by the same token, you also can't block yourself from thinking outside the box. And I think this has been one of the big challenges in digital health that I've seen is you see this spectrum of people with all the best intentions, whether they are entrepreneurs or innovators from outside of healthcare, who say, I just don't understand why it works that way. And my experience is because I was a patient. So any other industry, the stuff that I see would have been deemed to be anachronistic, it doesn't belong in the 21st century. But this industry seems to think it's okay. We got to change that. Sometimes they run into a wall because they don't understand the funding process and the buying process and the value chain and a number of other things, which takes time to understand. At the same time, then we sometimes see people coming from healthcare themselves who unfortunately have gotten quite jaded and they're a little bit reticent to take the big steps because they're worried about being beaten down by legacy. And that optimization is one of the key things to making digital health work really well. And so the best companies I see are pulling from both of those inputs to find the right place to be in the middle. But by and large, and almost entirely, all of them, wherever they sit on the spectrum, are motivated by making patient and provider experiences work better. And so, I was very open about the fact that I didn't fully understand healthcare when I came in. I have family members who work in it. I care a lot about something I feel is so fundamental to society, delivering better value to people. And this was the most inspiring mission for entrepreneurship that I could think of. Like, if you're gonna, it's almost that because it's hard, it's why it's worth it. Like we should never be afraid of taking on hard problems, and we have a lot of hard problems. And to me, this is one that that matters. Because of my family and being patients and being providers themselves and making it work better. But it's just, anytime I feel hesitant, I look at our customers and they're just so brave and so determined to make patient experiences better. How can you not be, sort of inspired by that?
Mm-hmm. We'll talk quite a bit more about what it takes to get one of these digital health companies off the ground and how MedStack is fitting into that picture to make it easier for sure. I guess maybe just one last question on this point of product management to try to wrap this up in a way that's relevant for future entrepreneurs. If somebody's not coming from a very strong product management background, that they didn't spend a decade plus kind of working in the space and really honing their skills, how would you advise them to go about entering the startup space?
Mm-hmm. Well, I have the benefit in my role, both at MedStack actually, and outside of MedStack as a mentor, in working with a large number of very early stage or first time entrepreneurs. And there are some common things that come up, which, are missteps that are really no fault of their own because it's sort of traditional thinking. The biggest mistake that happens is this problem in product management we call solutionizing, which says you see something and then your mind immediately moves towards a picture of how it can be different. And then you build the thing and then you say, okay, well, look what I've done. Is this the thing we need? And that is how most things get done, but unfortunately isn't the most optimal way to get things done. And so we really kind of draw a line back to the principles of what we call customer development that says the number one thing you need to focus on and spend time thinking about is the who. Who do you care about? Whose life do you want to make better? And that who can be a person or it can be an entity. It doesn't matter. There's this segment of society and you need to be as specific and narrow about this as you can be, because mathematically, as soon as there's any kind of heterogeneity, then causality of why I changed this and this happened becomes harder to determine. And in the beginning, that's what you're trying to do is build this repeatable equation. So who is it you care about? And have you talked to them? And that sounds like such an obvious, simple thing, but you'd be amazed at how many people haven't gotten to that step. Instead, they said, well, I went and coded about a UI demo, and I'd like to show everybody what it looks like. Have you talked to them? And if you can't talk to them, then are they really the right segment for you to go after? What is the thing that is frustrating them? There's a quote that I really like from, I believe, Mark Andreessen, who says there are two things for a startup to be successful. The first is they have to have a great team. And the second is they have to have a market. And by market, what he's referring to is there's a segment of people with a need. They're aware they have the need. They care about solving it. They're trying to hack their way through solving it today. And so therefore there's this, energizing potential in the market that you can address. Out of those two things, one of them can be fixed without too much effort. In other words, having a great team. But if there's no market, no amount of great team is going to matter. So spending the time on that is the thing that every new entrepreneur needs to solve. And here's the most amazing thing about that is it actually addresses another question that comes up with so many of my mentorship meetings I have. Oh, I got this great idea, but I'm not a developer. How come I can't hire engineers? How do I find a co-founder? You don't need to worry about that right away. If you've determined that there is a segment that cares about what you're doing, and they've told you they care about it, and they care that they're willing to partner with you to invest in a solution, but they don't even know what the solution is, then the right technical resources will come to you, because what everybody who works hard wants to do is solve a problem. And so that's my first piece of advice to any kind of new entrepreneur in healthcare or any other space.
Okay, lots of awesome information there. Let me do a quick plug in here too. You are a mentor for sure and an educator. I believe you also taught a course, sort of breaking down the fundamentals of privacy, security, DevOps. I don't know if I got that correct.
Yeah, so the course I taught was in product management fundamentals.
Okay.
And I in full disclosure, I'm not doing it any longer, but it was a really, really amazing experience for me, and I'm very grateful for having had the chance to teach. Big plug and shout out for BrainStation, which is the education organization that I worked with a couple of years ago, and they have an introduction to product management course, which I'd like to call out because it's actually not that common. And what I've actually found in a lot of cases with the education of product management is it tends to focus on a specific part of the spectrum. So you can have product management from the perspective of, we're going to teach you how to do like market research. Or you have product management from the perspective, we can teach you like, how do you energize a marketing organization, launch a product? Or, what a lot of people think of as actually the full scope of product management, and it's really only about a third of it, is we'll teach you how to work with an engineering team to give them requirements to build something. And I realized that was the sort of predominant spectrum of education in product management. When I had the opportunity to work with BrainStation to put together a curriculum, and it's now heavily evolved since then because they have some amazing instructors working with them now. We attempted to create actually an introduction whole story from the beginning to the very end of the entire journey of product management. And I did that for a few years, and met some really amazing individuals. And perhaps, the achievement that I'm most proud of is, that hour I took, or 90 minutes I took every Tuesday, led to a number of people who actually have very prolific careers in product management now, and they were completely new to it when they came to the course. So that was a lot of fun, and I've actually inherited some of that positioning that I delivered in the course now to some of the materials we use to onboard new employees at MedStack and to tell our story.
Mm-hmm. It's really cool to hear about. Not often you get to hear again somebody who founded a company, has your experience, but is also teaching the stuff so that other people can benefit from it too. Very much, I think, goes within your ethos of MedStack. Of really, you're in the business of helping others be successful, and I think it's a very powerful thing. Okay, so we'll use that point to kind of transition into, let's focus on purely what MedStack is, how it got started, and what you've learned along the way that's led up to this main product that I think you're really pushing for right now, MedStack Control. We'll get into what that actually is. So just to start off with, so you've got a wealth of experience, Simon as well, different sort of paralleling and complementary expertise, but you also decided early on to go through a number of accelerators. And I wanted to know, was the learning experience different in each one of these accelerators? Because you've gone through multiple.
Yeah. It's actually a bit of a point of humor for us as well. So MedStack has been really fortunate to be a graduate of the Dreamit Health program in Philadelphia, 500 startups, the Canadian Tech Accelerator, which is run by the Canadian Consulate in the US, and the DMZ Accelerator program. And we actually started our company in the DMZ co-working space as well. And then on top of that, we have memberships with Communitech and Innovation Factory in Hamilton and Venture Lab as well, and Obio and the Biomedical Zone. And we're a member of 111 before they went through their big transition earlier on this year as well. It's a lot. And so, the folks at 500 Startups used to give me a hard time to kind of say, oh, this is MedStack, you guys are the accelerator junkies. We didn't really sort of set out to do that, but when we went through the first one, Dreamit was just such a transformative experience for us. We were very early, fortunate to have had the advocacy of the Chief Innovation Officer of Penn State Medical. It's a massive sort of educational health system in Philadelphia that backs Dreamit, who brought us in and said, this is going to be something that's going to change digital health. And we learned a lot about running a company. We secured our first couple of customers, and we learned a lot about the US healthcare system. And it just left us hungry for more. And so, we came back, then we did the Creative Destruction Lab, which I didn't even mention that one as well, which is an entirely different kind of experience. And then every time we were given a new opportunity, we just said, yeah, of course. As long as it economically made sense. So we learned something new at each one. That's one aspect. And the second is because we are a company that services other early stage technology companies, all of these opportunities were great lead gen for us. And we maintained relationships with them all, and they actually continue to bring us opportunities. Sometimes we're actually going back and presenting to the new cohort as a presenter and part of the curriculum. I wouldn't say that kind of journey is the right journey for every company. And maybe it's, others could pick things up faster than we did, but we learned something new, sort of each time. I think Dreamit was very, very helpful for us to understand what a healthcare company is, so we could understand who our customers were and the kinds of things they cared about, and going with them, but actually watching them present to folks like Pfizer and Independence Blue Cross and Johns Hopkins and a few others made us understand what they're going to be facing, and so we could build a product that actually made sense in that scenario. And so we learned as much from our classmates as we did from the program itself. CDL, I'm a huge advocate of CDL. I think it's one of the most incredible assets in Canada's innovation economy. Was a wonderful experience, and just because they push you hard. We had to, every 6 weeks, we had to come in and show our progress and validate and explain it. And given the stage that we were in, we moved to revenue really, really quickly, but it was very lean startup. Everything was manual. And then we were just adding more automation as we went along. We had to really learn how to talk about our progress. Which, we had a couple of false steps, but in the end we did well, and we landed some investors who continue to support us today. And then 500 Startups was all about, okay, we did that. Now, what is this Silicon Valley thing everybody's talking about? And so we learned the Silicon Valley vernacular. Demo Day was a packed house full of Valley investors. We met so many amazing people. We learned how to talk about digital marketing, because that's one thing 500 does really, really well. That's also been, and they have an incredible alumni network, so we leverage that even today for advice on hiring and for leads and a number of other things. And then finally, the DMZ, when they came to us, to be honest, at first we were sort of like, we did all these programs, like, do we really need to do another one? And kudos to Abdullah and the team there, because they just said, give us a chance. Our accelerator program is kind of new, but we think we can help you out. And it was wonderful, because they really, really brought in the top-notch advisors and mentors in specific topic areas. Even to the degree that I've spoken to people creating new accelerators, I'm like, this is what you need to model after. So we had meetings on, people, on product, on sales, on operations, on fundraising, and with an expert each who actually knew our business. And we just, everything we accomplished transforming our company in 2019 was, a lot of that was because of the DMZ. So I guess in summary, we pride ourselves on being a learning organization. Humility is very, very important to us, both myself and Simon, and to the whole company. We never assume we know everything, and there's always room to learn.
And as a testament to that, I would say, you guys have earned a lot of honors. I'm just gonna name a couple of them because I think it's worth mentioning. Not a lot of companies can get to this level in the time that you guys have. So we've got the Canadian Innovation Exchange Top 20 Award, Canadian Advanced Technology Alliance Award. You've also been recognized under PwC's list of top companies changing healthcare in Canada, and I would say a little bit more broadly than just Canada as well. TechCrunch Disruptor Pick, and so on. That's just the tip of the iceberg. So again, kudos to you guys. And I would say along the way, and this is something that I wanted to get a little bit of insight from you as well. You've grown in terms of your customer, your client list, and learning from each one. I think as you've gone along, you're now at, I believe, around 60, perhaps a little bit more customers. Still growing through the pandemic and everything, as the digital health innovation is really booming right now. What is there anything that really kind of stands out as, and any particular case studies that really stood out to you as either a massive kind of learning point, a massive sort of disruption, or really kind of efficient process that could be replicated to other companies?
Oh wow.
There's probably
Yeah,
many,
a
but
lot.
yeah.
There are many. So we're actually pretty far north of 70 customers on our platform right now, um, and that's like live right now. We've had a few others that have come and evolved to other things over time. But I mean, I like to call that out because I think it's the experience of all of them that have sort of colored who we are. Um, and it's worth taking a moment to sort of thank our customers, because as a self-learning organization, we learn from each one. And they, a few of them have been very explicit about it. They say, we know you're early. Like, you guys are a startup, we're a startup. So here's some things we think you should think about doing differently if you want to make your customer experience better. And it's always really worthwhile hearing things like that. So we're constantly sort of evolving our messaging and our offering and the way we engage customers. Um, I'm very excited to sort of say, and maybe this is one of the sort of first times of kind of explicitly saying this publicly, we will have a new member of our team joining us right after, in the very beginning of 2021, who's going to lead customer success for MedStack. And she's phenomenal. I'm very excited to have her join our team, and already have her sort of full onboarding and ramp up planned out in our heads. And she's got big shoes to fill, but yeah, I mean, again, I think the thing that sort of drives me every day is our customers are doing very important mission-driven things that matter a lot, and in an industry it's really hard to sell to. Some have done some pretty phenomenal, like, even pivots as they've been with us, learning from what the market can adopt and do. And we've had some that have actually come to us, tried something, didn't really work, said, okay, we're going to rethink things and come back, left, and then came back with a whole new business and said, this is what we're going to do now. There's so many that I could point to, but some of my favorite stories are, we have one company that we work with based in Montreal that has built this phenomenally interesting medical device that is non-invasively diagnosing the recovery from knee surgery or recovery from knee injury. And they've actually gotten a huge amount of play in the sports industry, training athletes, which is Emobi. Michelle's company is phenomenal, and they're getting attention from all over the world, and they're based on deep academic science and what they do. We have a bunch of our customers that are working in the mental health space, which is really, really important. Not just in helping people find services, but also, the therapeutical aspect of measuring the recovery and the effectiveness of the treatment programs, also supporting their families through the journey. We have a couple of companies that are doing that. That's really, really important and matters a lot. We have some companies that are looking at the economic divide in healthcare, and how can you use digital health to deliver healthcare to people that normally might find it a little restrictive to get the care that they need. And then you have a whole suite of companies that are actually focused not on the patient, but on the provider. How do we provide a better experience so that the tools work better for them? Mutual Health and their company AutoScribe is a really good example of that, where they're using AI to help physicians have better clinics, essentially. And I mean, the list goes on, and some are really, really specific, and some are general. Some even, I find personal relationship with it. We have one of our customers, it's one of our newer customers, has built something that's actually mapped to a personal healthcare journey I'm in right now. So I'm like, I think I want to be one of your customers. Every single day. It's the best part of my business, is that like all of our customers are different, and I learn something new about the healthcare journey every day. But their relationship with us is all the same, and they constantly make us better. So the conversations around how do we make sure that our product is as transparent as it can be in what it does and how we charge for it. How do we make sure we're responsive and we prioritize the way we respond to our customers to make sure they're continuing to be successful in the right way? What do we do outside of our platform? Our customers are buying into not just our platform, but we feel and strongly believe they're buying into a community as well. So, can I make introductions for them? So just this morning, I made an introduction of one of our customers to our good friends at Zensurance, who have this really growing, powerful, corporate insurance policy that they're offering by way of customers through MedStack. So, these kinds of things in an ecosystem play is really important to us.
Yeah, that also gets back to this whole idea of building out an ecosystem where you can actually connect a lot of different players in the system to offer, I guess, an enhanced ability to collaborate rather than unnecessarily compete or try to outdo each other and do all these kinds of things that are probably hurting more than helping overall. I want to also call out though too. So Movi's actually been a past guest on the show. We had a conversation, I think, a little over a year ago. I had a chance to look at their website as well, and some of the work that's come out of that company over the last year. They've done awesome things, and so it's really, really cool to see that they've been able to achieve that, at least in part through their partnership with MedStack. Really, really cool stuff. So when a new client comes to you, what a new client or a new customer, a new healthcare startup, what do they look for? What are the sort of questions that you'd have to help them with, and how do you onboard them?
Yeah, great question. Something we're constantly trying to make work better and better and better. Our head of sales, Jacob, this is what he lives and breathes every single day. And we've got it down to a pretty strong science right now, both from perspectives for qualification as well as the journey of partnering with us. And then now with Serene coming on board in January, transitioning that into an ongoing relationship. Our first question to them is sort of, what are you doing and why are you doing it? And who are you trying to sell to? Sometimes we actually have these conversations with entrepreneurs when they're very, very early. And part of that is, again, through my network as an advisor and a mentor. I can meet founders in the very beginnings of their journey when they're actually, quite frankly, too early for MedStack. But it doesn't matter, because we can guide them in a way that says, give us a call when you're ready. For example, there's a new digital health company based out of Boston that I'm very excited about. They're very early, very young founders, extremely aggressive. They're not one of our customers, so I probably can't call them it that way, but I'm really hoping that they will be one day, because I think they're doing something pretty amazing. We have a lot of those kinds of conversations. But when they are ready, or even when we're first introducing them, we first understand what they're trying to do and who they're trying to sell to, because that is actually what we do. Is we are an enabler for market access more than anything else. And this is one of our new positioning that we've sort of developed in the last year, that says, because you're selling to these organizations, you're partnering with these organizations, they're going to be caring about this stuff. And be aware that's very, very complicated. And here's why it's very complicated. And almost categorically, the response is, well, yeah, I mean, that's not what I'm spending my time thinking about. I'm really worried about all the things we talked about, right? The buying process in healthcare and who my stakeholders are, and does my data science translate to something that applies to the medical science in the right way, and having the right team and things like that. But you're telling me that there's going to be these stakeholders I have to deal with. They're going to ask me a bunch of questions I'm not ready to answer. How do we handle that? And I'm like, okay, well, we have a solution for you, and it works this way. We will put you in the best light possible through automation. You don't need to understand how it works, but here's all the organizations we've worked with. here's the reputation we have, and the guarantees we're putting forth. All I need from you is you have to be this far along in your product development. You need to have some kind of an architecture in mind. Connect me with your lead developer. And at the point, usually it's, there's almost two parallel paths. One is preparing for the compliance readiness so we can have the CEO or the chief privacy officer reviewing our policies. They usually give us a heads up on who they're trying to sell to and the kinds of questions they're getting. And meanwhile, we have to make sure that the developer of the application knows how to use our platform. The good news is there's very minimal learning curve because we align to common developer standards like Docker and show them how it works. Do 2 or 3 demos, send them an invitation, and off we go.
Okay, so I want to break this down a little bit further because let's try to make this as easy as possible for any new company that needs to face this kind of challenge, and do it as efficiently as possible. And I'll also call out, you guys have a lot of great demo videos on your YouTube channel, so I had a chance to look at those. It's not my exact area of expertise, but even I think got the gist of it. So it's fantastic to see that. How would you frame the problem that a startup will face in talking to a hospital, a payer, what have you, and how do you guys solve that very efficiently and quickly and sort of seamlessly?
Yeah, and that's a great way to sort of put it, Dorian. What we typically say is, if you're partnering with any kind of healthcare enterprise, whether it's a payer, provider, clinic network, public health organization, big pharma, it doesn't matter, they have a responsibility for the safety of the patients and their data. And so they will have a rule saying that you have to demonstrate in real time, ongoing, that you're protecting the data just as if they were building the technology themselves. This is a very monumental exercise, which can range from, on one spectrum, show us what you're doing for privacy and security, all the way through to, we can't work with you unless you're SOC 2 or HITRUST certified, which does happen in some cases. And so that's the ask. Now, we know what all those things mean. And what they're actually asking for is 3 things. Is a technology architecture that enables these kinds of protections to be in place, the policies and documentation that commit you legally and contractually to doing those things, and a process to match their asks and expectations to what it is that you're doing. All those things are things that we automate. And our relationship with you is as an infrastructure company. We're not going to change the way your application is built or what it does. You retain all rights to your intellectual property and to all of your data. It's your data, not our data. We have no rights to do anything with it. And we're simply just helping you guarantee privacy and security. So then they say, that sounds great. What do we get from you? I said, well, you get all of our policies pre-written. They're now your policies because you're using our infrastructure. We show you the gaps where there are things that you have to do that are particular to you. We actually explain all of that. And here's probably the biggest selling point is any inquiry you get from one of your customers, you just forward it to us and we will answer it for you. We actually have a tool that matches our, uses almost like natural language processing to match our policies to the questions from a hospital.
That's actually huge. That's a huge, because like now you're in the customer service space, but like on steroids, because they don't even have to deal with the questions themselves. So now you're actually offering pretty much a consulting like service on top of the tech.
Yet we're not a services company. So you can do these things by way of hiring a consultant, but it is phenomenally expensive and very difficult to predict how much it's actually going to be. So our policy set and our answering service to our customers is actually built into our subscription. Now we do tier it. So where we say, if your process is actually working with an auditor to get a SOC 2 certification, that's a much more involved activity. So you need to be on the highest tier to do that. But if it's just an inquiry from a hospital, we'll answer it for you. Then their next question is, okay, good, this sounds amazing. What do you need from me? And I say, well, all we need is that your software is built in standard open source technologies, which is what most new software is built in, whether that's Python or PHP or Ruby or what have you. And you're building an architecture on containers. And anybody who's doing backend development will know what this means. This is not something we invented. Docker is a very common standard that everybody's using. In fact, we've actually partnered with Docker themselves on content to show that we're actually just meeting their own standard. And then it's usually just a demo. We show how the platform works to their engineer, where you log in, we show how the account system works, and you create the service, press a button. And what our system does is it sends commands into the backend cloud, which for us is Microsoft's Azure product, builds the infrastructure. It's a single tenant virtual private cloud just for this customer, in a manner that just allows them to send a standard Docker repository into that infrastructure to deploy their code. But we add all the security in, lock it down so it can't be changed, and then deliver them the policies. And it's instantaneous.
And this is what I love, is that it's beyond just digital. Like, I mean, the main sort of focus seems to be digital health companies, startups, but you guys have branched beyond that. We already talked about Movi. It's a medical device company, and you go far beyond that. So it actually has a very wide range of applications. But any entrepreneur that's looking to get into the healthcare space is potentially facing the same problem, right? Because they're all essentially selling to the same types of institutions and organizations that you guys cover.
Yeah, exactly. So from a technical perspective, we are a cloud infrastructure security automation and proving company. And the reason I word it that way is, like, we're guided by all of the requirements in healthcare, HIPAA, and in Canada, the BPA and the provincial regulations in healthcare. But the things they're asking for are all that we're focusing on are all the security rules. So is there a potential for MedStack as a company to one day service things even beyond healthcare where data privacy required? Potentially, yes. But categorically, our focus is healthcare because that's where the biggest gap is. And that is what our mission is to make healthcare work better. And we feel the makeup of our customers in this industry space are usually, medical science, quite often data science, because healthcare is an industry that runs on data precedence. So pulling in lots of data help with decision making, or even require providing recommendations, which is what a digital therapeutic would do, is a big part of it. And user experience, and we all know user experience for patients and providers could be better in healthcare. Almost all of our customers are made up of those three things, and they're not made up of a large infrastructure, data security, and privacy management team. So this is the gap that we're actually trying to close.
Mhm. What gets you most excited about the work that you guys are doing right now, with all the clients that you've onboarded so far? And obviously there are many more that I'm sure could benefit from the services you guys are offering. What's really getting you up in the morning?
Just what our customers do. It's a very, very important space that they're in, and very important work that they're doing. And their missions that they do with hospitals and with the healthcare industry and policy providers every single day is what heavily motivates me. And whether that's a new story from an existing customer or a potential with a new customer that we might be working with, I think about what life is going to be like when the product is live, and how things are going to be different from them every day. And that excites me. But I will also say that, we're sort of mission driven on three things. So the first is making healthcare work better, which we've talked a lot about. But the second is we're advocates for and champions for privacy and transparency, which is a very, very important conversation in healthcare, but in general. And so enabling our customers to tell a privacy first story in an environment where there's so much public discourse on violations of privacy and assumptions around how these things should work and the rights the citizens have. I feel like we're on the right side of that conversation. That really excites me. And the final piece is, I guess, especially for me personally, but generally in the company, is the economic benefits and the acceleration of innovation benefits that come from working with a platform company. If it wasn't MedStack, I'd be doing another platform company, because this is the stuff that's really, really exciting to me.
I love that too, because one of the big focuses that I have on this channel is the idea of expanding access to healthcare services, especially to marginalized populations and those in remote areas. It's very difficult to do unless you move towards you push the digital frontier, you really adopt that in healthcare. You guys are definitely accelerating that path, and it's just fantastic to hear about the work that you guys are doing. My background though is mostly focused on biotech and clinical trials and clinical development and innovative medicines commercialization. And I'm wondering if you guys have any examples of either customers that you're partnering with that are kind of focused on that space, or if you see opportunities to deploy MedStack in that area specifically, because obviously innovative medicines development is extremely expensive, and there's a lot of work to be done in terms of making that process more efficient. Clinical trials, identify new biomarkers, and so on. Is there any way that MedStack can help in that area specifically?
Certainly, yes. There are a bunch of really interesting companies in the space of the process of recruiting for clinical trials. So one of the big challenges that therapeutic researchers face is producing the data that backs their claims on the efficacy of their treatments. And then also that data is required for them to even get certified, whether you're talking with the FDA or Health Canada, et cetera. And so there's a huge sort of opportunity available to make the sourcing and planning of a clinical trial work better. And we've come across a bunch of companies who are doing something really interesting in the space, especially in this new environment where you can no longer invite people to, visit a facility and be tested and screened for participation in a trial. It has to be done digitally. So how do you find the people you need? How do you deliver them the treatment, guide them through what they have to do, and then source the right data to feed your medical research accordingly? I think it's a really interesting space. It is a space that involves A, the cloud, and B, personal health information. So MedStack can absolutely play an important role in making this work better. And then once you found the people, of course, you have to gather all the data. And so I think the whole aspect of home monitoring plays a really interesting role in the development of new modalities of treatment. Especially when you think not just of medication, but you think of digital therapeutics. And I keep coming back to this because it's such an exciting field for me. If you can take an individual who is suffering from a condition and prescribe a pharmaceutical to them to manage their condition, or prescribe a medical device to them to manage their condition, there has to be some cases in which you prescribe an application to them to manage their condition. And we're starting to see this. Everything from, guiding therapies for mental or mental health or even physical therapy, through to things like virtual reality therapy. And I love the work that's being done in this space specifically. It's challenging because you actually have to get certification the same way you do for the other kinds of therapies. But this is all happening at home. And so the data is in the cloud, the data is flowing. There's lots of people involved in the care and all of the precursors for how MedStack can help.
It's really interesting you mentioned that too, the mHealth applications. They've been around for quite a while now. There's I believe the UK and I think other countries have created lists where physicians can actually prescribe. These are like, physician recommended, according to guidelines, recommended apps for a particular application. So really interesting, really exciting field. Looking forward over the next couple of years, so if you launched MedStack Control, I'm wondering what do you see coming up next in terms of either expansion to other regions or offering new products, new services?
Yeah, certainly. We're thinking about both. The ultimate mission of MedStack is to provide software services to the founders of digital health innovations and to the buyers of those innovations and sponsors of those innovations, so that we can increase the funnel size of solutions that exist in the market. And the first problem that we're tackling is automating privacy and security in the cloud. But we have our eyes on other things, and not to say that we're going to build them all, because I'm excited to say that in this space there are lots of people trying to tackle different arms of this problem. And so we do see expansion happening in a few different ways. MedStack is already an international company in the sense that we, from the perspective of the first problem that we solve, almost all of our clients are in North America, but some of those clients have bravely taken steps to service other healthcare markets. And so when they come to us with this proposition, the first thing we do is say, well, sort of what market are you looking for? And when they tell us, we map our policy set to the predominant laws and expectations and industry regulations in that region. And you know, a bonus for us is in almost all cases we haven't had to modify what we're doing, because following the principles of, you know, ISO and NIST and HIPAA allows us to actually put our best foot forward in almost all markets. Then we simply make the infrastructure available in that region, and they can deploy. So MedStack is actually currently running in multiple markets around the world already for that reason. But beyond that, there are really interesting digital health ecosystems that are happening in different parts of the world. You know, I'm particularly excited about places like the Netherlands and Australia, Singapore, and even some things happening in Latin America and South Africa, places like that. So we do have a view towards doing more business development in those regions sometime in the next couple of years. With respect to a product perspective, you know, the other thing we're thinking about now is, now that we have this repeatable proposition by way of MedStack Control, it's easy for developers to onboard. The proposition for compliance is transparent and provable and proven. How do we partner with more organizations to bring this to more companies? So we're building, you know, some yet to be announced, very exciting partnerships with innovation ecosystems, company co-creators, accelerators, et cetera, where MedStack will be part of the proposition. We're partnering with other service providers, some of which are well known, and others that we're working towards right now that service other aspects of the digital health journey, so we can package our solutions together. And then we're in, you know, constant conversations with the cloud vendors themselves to help them in their journey to service the digital health community by way of what MedStack's doing. So these are some of the things that we're working on for the next couple of years.
Just some of the things, right? I mean, just a couple of things. Sounds like a lot of work. No, really excited to see where all that is going to go. We're going to be on the lookout for sure for news and PR releases. For today, I really appreciate your time, Balaji. This has been an awesome conversation. I want to turn it over to you quickly for the last couple seconds or so, if you've got any kind of final take-home thoughts for the audience, and then we'll wrap up after that.
Yeah, thank you very much, Dorian. I really appreciated this conversation, and thank you to you for what you're doing. This is an important discourse to have. Healthcare is never going to be the same again after this year, and I think a lot of people are benefiting from the hope of being inspired by the kinds of innovations that are happening in our space. So I guess the first thing I would like to say is, for everyone who is working in the healthcare industry and any aspect of it at the time when the world needs you more than ever before, you have my gratitude and my encouragement and my admiration, and those of the MedStack team. For entrepreneurs, you know, no matter what you do, just remember that your mission is, because you're changing legacy, because you're creating a new solution, and you lack the preconceived notions that may exist in there. Solve hard problems, and if it's healthcare, we'd love to help if there's any way. But no matter what, solve hard problems, and you know, keep fighting the good fight, as it were.
All right, beautiful. We're going to include links to your social media channels in the description below. And if anybody wants to get in touch with you, we'll see if we can include an email address as well. Look forward to building these partnerships as well. So thanks so much for your time today, Balaji.
Thank you very much, Dorian. Good talking to you.
Beautiful. Take care.